One thing I think this pandemic has taught us is that our definition of the term normal has changed. It continues to evolve. In the new normal, I give you the tools to learn how to think like a doctor, develop the resilience that we all need to come through these pandemic times and to come out on the other side not just wiser, but also healthier. One of the things I think that this pandemic has taught us all is that at the end of the day, we have to be in charge of our personal medical health destiny. Physically, that really starts with asking yourselves, am I at higher risk for COVID-19 or any other infectious disease for that matter? So that includes your racial or ethnic background, your age, your body weight, any pre-existing or chronic medical conditions. And then you do a deep dive from there and really ask yourself, how ready am I? So am I in touch with a medical professional or healthcare provider on a regular basis? One of the consequences of this pandemic, and it's been a negative consequence, is that millions and millions of Americans have delayed, postponed, rescheduled, or canceled altogether their preventative wellness visits, cancer screenings, other kind of healthcare screenings that are very important for prevention. It's understandable why that happened. Certainly at the beginning of the pandemic, all elective or non-emergent medical screenings or visits were canceled. That was so that the healthcare system could shift. But as we've come out of that, a lot of people have continued with that reluctance to go for wellness checkups. A lot of people who suffer a comorbidity or have a pre-existing medical condition don't know they have it. So yes, it is important, if possible, to schedule that preventative or well person's checkup so that you can be screened for anything from depression, mental illness, to heart disease, high blood pressure, high cholesterol, and diabetes. When anyone goes for a medical checkup, ideally you bring someone with you who provides another set of ears. At that appointment is when you should take the reins. And if that person doesn't ask you about how you're living, where you're living, with whom you live, what kind of work you do, unfortunately, a lot of times those questions don't get asked. So don't wait for someone to ask those questions. Offer that information up and don't be afraid to ask a question ever. When you're actually at the visit, you want to ask the healthcare provider, who do I contact if I have questions? How will I get the results of any tests that are done today? It's always a great idea to keep hard copies of any diagnostic test, procedure, surgery, biopsy, or medication regimen that has been provided for you or to you. Remember, this is your medical information. Go into it with the mind frame that you may detect something on screening, something may be diagnosed, but that you have people around you, both in your medical team and in your social and personal circles, that will help you get through it. We are living through a very prolonged period of stress, in some cases trauma, fear, and uncertainty. And therefore, this pandemic has affected everyone from a mental or psychological standpoint. It's just shades of gray. It's a matter of how much, how severe, and anyone who doesn't think they've been impacted on a mental or psychological level, I would really encourage you or suggest that you reconsider and ask yourself how you're doing. I have experienced them myself personally. From the beginning, I noticed a change in my baseline anxiety levels, and I noticed that this stress and anxiety was even infiltrating my dreams, something called pandemic dreams, which psychologists have been on top of defining and documenting and observing and researching from the beginning. When things start coming out in your dreams, in your subconscious, to me, that is a glaring sign to take a closer look. Ask for help. There are so many remote apps that can provide mental health screening, support, awareness, even some cases diagnosis and treatment in times where it's hard for us to get into the same room with a mental health professional. Just like we should be careful how we speak to others, we should also be really careful how we speak to ourselves. One tip that mental health professionals often will recommend is that you actually speak to yourself in the third person. It helps remove you in some ways from an ego standpoint from the situation and bring you out of yourself in a certain sense to achieve a positive effect. So that would sound like this: Jen, I know this seems overwhelming, but you have the ability to get through it. When you use your own name in the third person, it can be really, really powerful. So while it might seem silly or funny, many psychologists suggest it can be really effective. It's important to remember that also self-care is not selfish, as the saying goes. Self-care is, we start where you are, we meet you where you're at, and then work from there to improve things. So for me, it's really sleep, the fitness, the spiritual and psychological self-care practices, and making sure that I'm putting clean, healthy fuel in my tank from a nutritional standpoint. There are people for whom this pandemic may in fact represent a tipping point in terms of their mental wellness or mental illness. People who have a history of psychological or psychiatric illness are at higher risk. So that includes people who have had clinical depression, anxiety, PTSD, who have or have had a substance abuse or use disorder. So I think that if you start to feel that you can't get through your day, you are feeling increasing helplessness, hopelessness, despair, you're having thoughts of self-harm, absolutely that is a psychological emergency, and you should either go to an emergency room or make contact with a mental health professional immediately.